Most morning back pain isn't because your back is weak, it's because it's stiff, dehydrated, and completely unprepared for movement after hours of not moving at all. That's why getting out of bed is when people tweak something. In this video, I'll show you a gentle bedside routine designed to safely wake up your spine before you move, not stretch it aggressively. I'll explain why mornings feel worse, walk you through 4 slow movements you can do without leaving the bed, and show you the safest way to sit up so that you're not risking your back on the very first move of the day. If mornings feel tense, fragile, or unpredictable, this will give you a calm, repeatable way to start your day without that fear. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. Morning low back pain feels worse because your spine has been still for hours. While you sleep, your spinal discs rehydrate and slightly expand, but without movement, that surrounding muscles and the surrounding joints become stiff and less responsive. That leaves the low back feeling tight, fragile, and easily irritated the moment you try to move. Add any underlying spinal conditions like degenerative disc disease, spinal arthritis, disc herniation, or stenosis, and it's easy to see why morning stiffness can feel even worse and more unpredictable. This is why these 4 gentle movements are so effective. They gradually reintroduce safe, controlled motion after rest instead of forcing your spine to handle sudden load. I designed this routine to be followed in this exact order from number 1 through to number 4 because your spine needs a gradual transition from rest to movement. Each step prepares you for the next one by first easing stiffness and pressure, then activating protective core support, restoring smooth motion to the hips and lower back, and finally teaching a safe way to sit up so that your back is ready for the day ahead. Let's start with move number 1, gentle spinal elongation. So we start with gentle spinal elongation because your back is at its stiffest and most sensitive first thing in the morning. This movement helps reduce pressure and tension without forcing motion, giving your spine a safe way to wake up before anything more demanding happens. For the gentle spinal elongation, you're going to want to stay lying comfortably on your back and keep the movement slow and relaxed. You're going to start by simply reaching your arms overhead while gently pointing your toes away from you. Think about creating length through your body rather than forcing a stretch. I want you to breathe normally and let your body soften as you hold the position. You're going to stop well before pain or strain and keep the effort light and controlled. The second move in the morning routine is what we call pelvic tilts. So most of you are probably familiar with pelvic tilts. This comes next because your spine needs support before more movement. Pelvic tilts gently wake up the deep core muscles that protect your low back and help it feel more stable and secure. For number 2, we're going to do what we call pelvic tilts. You've seen these many times before in my videos. What we're really doing is we're preparing the core. So you're going to stay lying on your back with your knees bent and your feet relaxed. You're going to slowly tilt your pelvis backwards to gently flatten your lower back into the mattress. Again, you've just woken up. All these are gentle movements. You're going to lightly engage your core and your glutes without bracing or holding your breath. Then you're going to tilt it forward. You're going to move in this smooth, controlled rhythm, not a forceful squeeze. I want you to focus on control and awareness rather than range of motion. You can go through 10 of these movements as long as they're nice and gentle and controlled. And again, remember, we're not forcing anything. You've just woken up. We're simply preparing the core. The third move in this morning routine is the knee to chest stretch. This comes next because it gently increases flexibility in the lower back and glutes once your spine is supported and warm. It helps reduce lingering stiffness without putting your back into a vulnerable position. So number 3 is going to be our knee to chest stretch. And again, all easy movements. You're going to stay lying flat on your back. You're going to bring one knee forward to your chest one at a time. You're going to hold that leg comfortably. It's not pulling. We're not forcing the stretch. You're going to keep your head and neck and shoulders relaxed on the bed. I want you to breathe slowly and allow the stretch to soften the muscles. Then we're going to switch legs, and we're going to do that again with the opposite leg. Again, you're going to go through maybe 10 of these, 1 on each side. I want you to move within a comfortable, pain-free range and switch the sides smoothly. Move number 4 in this morning routine is the log roll to sitting move. So this comes last because it's the most demanding movement of this routine, and it should only be done once your spine is warm and supported. It teaches your body how to transition out of bed without sudden bending or twisting that can irritate the low back. And last but not least is number 4, what we call the log roll to sitting. So people wake up in the morning, they're ready to get up, they actually do some gentle movements, and then they mess it all up by the way they get out of bed. So the key point here is I want you to roll onto your side as one unit. One of the big mistakes people make is they want to throw those legs off the table as quickly as possible. Please don't do that. It's like you're throwing an anchor to what's going on here. So you roll onto your side as that one unit. You keep your shoulders and your hips all moving together. You're going to let your legs gently drop off the edge of the bed. And while you're doing that, you're going to use your arms to push yourself up instead of pulling with the back. You really should feel no strain in the back whatsoever as you do this. I want you to keep your spine long and neutral as you sit up. You move slowly through all this and stay in control the entire time. Give these 4 moves a try tomorrow morning. Together they form a gentle routine designed to reduce morning stiffness and help your back feel safer and more comfortable when getting out of bed. If you found value in this video, like it and share it so others who wake up with back pain can start their mornings feeling more confident and supported. After trying this for a few mornings, come back and drop a comment to let me know how it worked for you. Be sure to subscribe if you want to learn more tips and strategies for treating and relieving debilitating back and neck pain without relying on drugs or surgery. And if you're looking for sleeping relief positions for both sciatica and low back pain, please go watch this video next.